Hello, Professor Steve Ryan. My name is Danny Martinez. Today is April 14th, 2014, and this is my demonstration speech. For my demonstration speech, I am going to be showing how to introduce yourself to a new patient in a hospital. This is important and also important to have a game plan on how to introduce yourself to a patient for a numerous amount of reasons. Maybe the most important is for time saving reasons. You have more than one patient throughout the day, maybe six as a patient care assistant. So learning simple little phrases um, can save time, which will be important because then you have more time for each patient. Um, so when first interacting with a patient, you're first gonna maybe give them a list of names, names being nurses, names of charge nurses, and maybe the doctor's name. But if you're in a hospital like Hoag, Newport, the one that I work in, they have a numerous amount of doctors that they see throughout the day, so you might not know the name of the doctor off the top of your head. Why this is important is because as new nurses, we're going to be going through clinicals. So we're going to be having some of us that first time interacting with a patient. Um, for others, like myself, will have some experience doing that. For myself, I have 5 years experience working in the medical field, introducing myself to medical patients, to patients. So I that's another reason why I think I'll be a really good choice to demonstrate this. I worked in nursing facilities and now a hospital. So patient interactions, bedside interactions aren't something necessarily new to me. I'm not perfect at them, but I think I'm just about ready to maybe if I needed to demonstrate what you would do. Um, so let's see. So today my patient is going to be Clarissa Salazar. She's my girlfriend, so she's going to be sitting in that chair because we don't have a hospital bed. We're not in a hospital. We're in a library. Also, I don't have my equipment, so I couldn't take a blood pressure or temperature. So we will need to pretend. So bear with me, but I'll try to make it as realistic as possible, showing you the most authentic way to introduce yourself. Again, first patient interactions are important because showing them that you're confident in what you do and knowledgeable and caring is goes so far with patients because even though it's our job for them, it's kind of like the worst days of their lives. They don't want to be in a hospital, so showing them and explaining to them that you could be confident, caring, and knowledgeable about your job goes a long way. So give me a moment. I'm gonna go get our patient. She's gonna be sitting in the chair, and we'll take it from there. Hi, is this Miss Salazar? Hello, Miss Salazar.
Hello.
How are you doing today?
I'm good.
How was your night?
Good.
Was it restful?
Yeah.
Okay. Today, your nurse's name is gonna be Sarah. Your charge nurse Sam, and I'm gonna be Danny, your nursing assistant. Is it okay if I put your blood pressure cuff around you? Okay. So right here, I have to pretend, but it's the best we can do. Pretend. Put on the blood pressure cuff. Close the curtain for patient privacy. This will be our curtain. Okay. At the hospital that I work at, I'm lucky enough to have automatic blood pressures on the wall connected to monitors. So once the blood pressure cuff is on, I could go ahead and click the monitor on, and then I'll take my thermometer, pretend to take her temperature. Miss Salazar, your temperature is 97.9. We wait a second for the blood pressure cuff to keep reading, and then it pops out a blood pressure of 120/70. Perfect. Okay. Once I have my ratings, I can then again introduce myself again, let them know if they didn't hear me the first time. My name is Danny. I'll be your patient care assistant for today. You could ask them a number of questions like I did in just right now. How how was their night? Did they rest well? Do they have any questions? Is another important one, like I was mentioning. Do you have any questions, Miss Elser?
How long for the procedure until I get discharged?
Okay, so questions like procedures, when would they get discharged? It's best to just tell them that the nurse would know. This is important because you don't want to give them a wrong time or wrong information because this might anger them in the future. So, if I was going to give them a time, I wouldn't be for sure. The nurse would know, and because the nurse will be talking with the doctor directly. So, Ms. Salazar, your time for your procedure would be a little later today, but let me check with the nurse, okay? Before I give you a time that could be incorrect. Discharge time, again, let me ask the nurse, okay? Okay. So, that's a little brief demonstration how you'll introduce yourself to a patient. For the rest of the time, I'm going to go ahead and let our patient go, and then I'll explain a little bit why this is important. Okay. Here you go, Ms. Salazar.
Thank you.
So, what you saw there was a little reenactment of what would happen in a first patient interaction. I stepped in the room, knocked, introduced myself. I closed the curtains. I put on the blood pressure cuff. I took the temperature. I wrote down the vitals. I put the names of important people that the patient will want to know. Excuse me, names of nurses, names of charge nurses, a nurse versus a charge nurse. The title are is different, and it's important because the charge nurse is kind of like the unit leader of the nurses. She has updates of all the patients instead of specifically a certain amount of patients. So she would be the charge nurse of the day. These nurses have more experience. They've been maybe working on the unit longer than others. So they have a leadership type role. Um, Patients will usually talk to the charge nurse if they have more concerns about their care or they want maybe a change in room or it's a step above a nurse. Not more important, both charge nurses and nurses play an important role in patient care. Nurses will be more bedside, more hands on, but charge nurses do have a senior position over nurses because they usually have more experience and have been maybe at the unit a little bit longer than other nurses. Um, so today I demonstrated again how to introduce yourself to a patient. This is important because, like I mentioned, first patient interactions can really set the tone of the day, showing them that you're confident, knowledgeable about your job, puts the patient at ease, especially if they have family members in the room. Uh, Again, the way you'll navigate that might be a little differently than just a single patient in the room than versus the patient in the room and other members. Um, Another reason why you want to practice your first time introducing yourself to a patient, like I said, time saving reasons. This is important because you'll have more than five, six patients sometimes. So going through, introducing yourself, letting them know, the answers before they even ask the questions could go ahead and save you a lot of time, a lot of energy and effort. Anyway, thank you again. My name is Danny Martinez. Thank you, Steve Ryan. This was my demonstration speech. I appreciate it. Hope you like it. Thank you.